They don't come in with one medical problem. They come in with 5 medical problems, 20 medications. So 15 minutes is really not enough, but we try to make it work somehow.
Oh, okay.
Try to
So
do our
even
best.
like
Yeah.
explaining to them about their problems would be difficult if they're like 100 years old. What's good, YouTube? Today we will be talking about what internal medicine physicians do, and we are joined by Dr. Saad, who is an internal physician, and she will be talking about what her journey looked like and what she does. It's really interesting, so stay tuned. Welcome, Dr. Saad. How are you today?
I'm doing well. Thank you so much. Thank you for having me.
Yep. Um, well, first of all, how about you introduce yourself?
Okay, thank you. So my name is Moisa Saad. I'm an internal medicine physician. I work currently in California, but I will be moving to a different state soon. I went to medical school in Iowa at Des Moines University, and then I did my internal medicine residency at University of Connecticut.
Oh, wow. Okay.
Yes.
Um, can you tell us about how you got into the medical field, and what interests you?
Sure, thank you. So I'm from Pakistan originally, and I don't know if you know or your audience that in Pakistan you don't get many choices.
Yeah.
As a career, you're told you have 3 choices: lawyer, doctor, or engineer. So those were my choices. And I liked biology from the very beginning. I loved, playing in the backyard, looking at animals, trying to figure out how things work, how natural things work. So I had an inclination towards organic life form anyway. And then in college, I did biology, really loved it. And then actually, I got married. So after my undergrad, after I completed, I got married, I had a baby, and my goal was to just be a stay-at-home mom. But my husband, he's also a physician, so he really inspired me and reignited that fire that I had that I wanted to do medicine. And then when my daughter was 3 years old, I got accepted into med school,
Oh,
and
okay.
it just took off from there. Alhamdulillah.
How was the experience of going to med school with a child, and how do you think it differs from people who don't have those extra responsibilities?
It was really, really good actually, Alhamdulillah, because I had my daughter and I knew that when I was in med school, I really had to focus and I
Mm.
can't waste any time. So I was very efficient at studying compared to my other students that were in the class. They would, spend time on YouTube, Facebook, just waste away hours and hours not realizing. So they would stay up all night studying while I would be in the class, study hard for a couple of hours, then come home and be a full-time mama and a wife. So Alhamdulillah, it worked out really, really well actually. It was very easy, I would say. The first 2 years were very easy. The second 2 years for of med school is elective. So you have to go work at the hospital, you have to shadow doctors. That was a little hard because you have long, long days, especially
Yeah.
in rotations such as surgery, cardiology. You have to be at you have to be at your rotation starting around 6 a.m. and sometimes you don't come home until 9 p.m. So
Yeah.
as a mother, that was the hardest part for me to be away from my daughter for so long. But I adjusted pretty quickly. I figured things out. So at the end of the day, it all worked out.
Oh,
But
wow.
the school part was easy because I had to be super focused.
Wow. Okay, that's really amazing. Um, so how about you go into detail about your profession and what you do?
Yeah, so I'm an internal medicine physician. So internal medicine physicians see adult patients. We do not deal with pediatrics or we don't deliver babies. So it's adult medicine. We treat most illnesses that you can think of: diabetes, hypertension, uh, some cancers, skin problems. Uh, and I love doing internal medicine because you're kind of the first person who has to figure out what's going on with your patient. So it feels a lot of like detective work.
Mm.
Um, and then you diagnose them, you treat them. If you need help, then you can refer your patients to specialists such as cardiologists, surgeons, orthopedics.
Mm.
But it's bread
Okay.
and butter. Internal medicine is bread and butter medicine that you can think of. You know, when you think of a doctor,
Yeah.
internal medicine is the doctor. Most
Yeah.
people kind of have that concept in their mind.
Yeah. Yeah. So I just had a quick question. Are you a MD or DO?
I'm a DO. So I went to an osteopathic medical school because that was the school I got accepted into, and it was the closest to my husband's residency. He was doing a residency in Iowa, and I wanted to be close to his place. And, I got really lucky. I got accepted into the medical school that was right next door to his residency program. So I didn't have to move out of state for my school.
Oh, okay. So what's the difference between DO and MD?
Yeah, so medical doctors study traditional medicine, allopathic medicine. Osteopathic physicians study the same books. Everything is exactly the same. But as an osteopathic physician, the focus is more when we train, when we go do our training for the second half of the medical school. The focus is more on whole body. For example, if a patient comes in with chest pain, then you don't just focus on the heart. You have to take a step back and think, okay, if there is something else going on. So it's a more holistic approach. I think a lot of the allopathic programs are trying to do that too now because it,
Okay.
it, it, it works really well.
Mhm.
The other part is that as an osteopathic physician, you learn about the muscles and the bones in a lot more detail,
Okay.
and you learn some manipulative techniques to help patients. For example, if a person has back pain or rib pain, then you learn some hands-on techniques or kind
Oh,
of a massage, if you may, that you can do to help your patients. Having said that, though, most osteopathic physicians don't practice the hands-on part anymore
okay.
because it takes a long time
Mm.
for example, fix somebody's back. You have to spend 1 hour with them, and unfortunately, insurances don't let
Yeah.
you do that.
Okay.
You're not gonna get paid for that time.
So you're mainly giving prescribing medicine
Yes. So
after, yeah.
as an internal medicine physician, osteopathic, allopathic, we do exactly the same thing. So you
Okay.
diagnose and you treat. Mhm.
Okay. Okay. And wait, so do you work in a hospital or
So I do outpatient, mostly outpatient medicine, but sometimes I do inpatient as well. Yes.
okay,
So when I do
so
inpatient medicine, I see people in the ER. So the ER physician, emergency physician sees the patient first, and he or she decides if the patient is sick enough to be admitted to the hospital.
okay.
If they are sick enough, then they call me, the internal medicine doctor or family medicine physician, whoever who is on call, and
Mm.
we go into the emergency room, we admit the patient to the hospital, and then
Okay.
we also take care of them throughout their stay at the hospital.
Okay. Um, can you tell me what the difference between outpatient and inpatient is?
Yes, of course. So outpatient medicine is, for example, you have an earache, right? So you'll call your doctor and you'll go see them in the office. They will take a look at your ear. They will give you some medicine to make you feel better. You go home. So that's outpatient medicine, meaning that you don't need to be admitted into a medical facility.
Oh,
Inpatient medicine is, let's say, somebody gets into a car accident, or they have a stroke. Then they will go to the hospital. They're super sick, and then they get seen there and they get admitted to the hospital. They go on the floor somewhere upstairs, and they're there for a couple of days until they feel better. So that's
oh.
inpatient medicine. Outpatient is when you don't get admitted to the hospital.
So you do both?
Yes, so I'm mostly outpatient, but sometimes I do inpatient work as well.
Okay. So what's the
Yeah.
most common thing you see?
Most common thing as an adult medicine physician, it's hypertension, diabetes, and then common medical problems like, ear aches, urinary tract infections, skin infections,
Yep.
headaches, yeah, things like that.
Okay. So that's nice. Can you tell me how your normal day looks like? So like when you get there in the morning and stuff.
Yes. So when I get to work at in the morning, I start at 8 a.m. So my patients are usually already in the room. My medical assistant puts the patient in the room. She takes their vital signs, their blood pressure, heart rate, temperature, and then I go into the room. I talk to the patient. We figure things out, what's going on, what's bothering them, and then I diagnose them, and then I prescribe them medication, or sometimes we need x-rays. Sometimes I need to ask a specialist what's going on. I prescribe those things and then they go home. And I see patients every 15 minutes. So it's a tough, long day. You
Yeah.
keep going. You don't really get any breaks other than your lunch hour. During your lunch hour in a busy practice, you're mostly catching up because as an outpatient physician, actually all physicians these days, we have to document. So whenever you see a patient, you have to write down, what did you talk about? What was your physical exam finding? What did their heart sound like, lungs sound like?
Yeah.
Then any lab you ordered, you have to mention them in your note, and then your diagnosis and your plan. How are you going to treat the patient? So it's
Okay.
a 1 to 2 page note. So you have to do that for every single patient. So you can do that as you go along. Some physicians these days, they're typing while talking to the patient. I try not to do that because I like to make
Yeah.
eye contact to make sure my patient knows that I'm listening to them. And
Mhm.
then I try to catch up during lunchtime. Um,
Okay.
as an outpatient physician, we also get messages from patients. So, you
Yeah.
can call your doctor, right? I have an
Yeah.
earache. What should I do? Those messages come to us in an
Yeah.
email form. Then we answer them. So we try to do that as we're seeing patients throughout the day or during lunch hour or at the end of the day.
Yeah. Actually, I used to volunteer at my pediatrician's clinic, and so she'd have me for the first few weeks. She'd just have me answering all the calls and the messages because she had so many patients she couldn't keep up. So
Yes.
yeah, that's just I've done that, and it's kind of
That's awesome. That's very
um
good.
yeah. So I had a question. How many patients do you see a day?
It depends on the day, how busy it gets, but I see 20 up to 25 patients a day. That's pretty typical.
Okay, 20.
Hmm.
And do these patients make appointments or they just walk in?
No, they have to make appointments. If everybody walks in, it would be a
Yeah.
disaster because you can imagine like five people walking in
Yeah.
and you can't see them at the same time. So we have them make appointments. Usually I have openings every day. I have at least 4 open slots. So if one of my patients is sick, then they can call my office and get in the same day. So, as an outpatient physician, you have your patient panel. So for example, I have about 3,000 patients right now. They're my patients. So it's my responsibility to take care of them. So whenever they get sick, they need anything, they call my office directly.
Oh, okay, okay.
Yes.
So do you take new patients or do you just stay with those 3,000?
Yes, because 3,000 is a lot of patients. So most physicians cap their practice around 2,000 patients, 1,500 to 2,000 patients. I have about 3,000, but a lot of them are young patients, so they don't come in that often.
Yeah.
Older patients with a lot of medical problems, you have to see them at least twice a year, if not more often than
Yeah.
that. So if you have a lot of older patients, ideally you want to have maybe 1,500, not more than that, because you want to make sure that you have time to take care of them.
Okay. So do you work every day of the week? 5 days?
No, I don't. So I work 4 days a week. I'm off on Wednesday and then Saturday and Sunday. So that's the perk of doing outpatient medicine because clinics are closed on the weekend. So as an outpatient physician, you work only during the weekdays. If you do inpatient medicine full time, then you have to work on the weekends and you have to work nights.
Oh, okay.
Yeah,
Okay,
so
so
as
mm,
a mom, that's why I
yeah,
decided to do outpatient.
mm,
It's better because I have time for my children as well.
yeah,
But another good thing about outpatient that you do not get in inpatient setting is that you, as an outpatient physician, you have your patient panel. So you really get to know your patients. They're
yeah,
your patients. You have ownership. So you can follow them through the years. For example, I've had patients who've been with me for at least 9 years now. So I can see how they're growing, how their
Yeah.
health is changing. I really get to take care of them really well. When you do inpatient medicine, you don't have a patient panel.
Yeah.
You see whoever walks in. So, you might really like the patient, but once they leave the hospital, you don't know what happened to them.
Oh,
So
okay.
I really did not like that part. I
Yeah.
enjoy taking care of the patient through their life as they get
Yeah.
older.
Yeah.
I want to know what happened, are they okay or not?
Yeah. Yeah. That definitely makes sense. But so on the weekends and on Wednesday, are you still doing some work or is it mostly free?
So I'm very efficient. Most doctors, unfortunately, outpatient doctors spend a lot of their time doing documentation on their day off. I am super efficient. I try to finish my work at work. So no, I do not do any work at home. Sometimes I take calls. So, on the
Okay.
weekend, sometimes outpatient physicians, we have to take call. What that means is that if a patient is sick and they call the office, they get connected to a special line where the doctor is sitting on the phone. You don't have to sit on the phone because cell
Yeah.
phone, you can take it
Yeah.
anywhere. And then you talk to the patient and you tell them, hey, yes, you're sick, you should go to the hospital, or you're gonna be okay, just wait until Monday and you can go see your doctor.
Oh,
So,
okay.
but you don't have to do that every single weekend. So I do that maybe a couple of times a year. It's not that
Oh, okay.
often.
Okay. So
Yeah,
on
but
those
other than
calls,
that, I try not to work at home.
oh, okay, okay. So do you diagnose on those calls or do you just kind of look at them?
It depends. So on the call, some problems are easy. You can diagnose them. Some problems you have to put your hands on the patient and, really examine them. So it really depends on the problem.
Hmm, okay. So how do you work with patients to help them understand and manage their own health?
You have to spend time with the patient. So you have to sit down with them, you have to counsel them, you have to break things down and explain it in simple English, not medical words. And so in my practice, I really, again, making that eye contact, I think helps a lot.
Yeah.
And then I try to write notes for my patients. These days, a lot of doctors just do printouts. They print out information of whatever that's going on with the patient and they hand it to the patient so they can read it on their own. I do that sometimes, but most of the time I sit down with a notepad in my hand. I'm kind of old school. So I write everything down, I make bullet points.
Yeah.
Sometimes I make drawings of what's going on, what to expect. So my patients, they follow me and they have questions. If they have questions, they can ask me right there and then.
Oh,
So
okay.
I use simple teaching techniques to really tell them what's going on. Yeah, stuff like that. And sometimes I use the internet. So sometimes I just Google a picture because
Oh,
pictures
okay,
are
okay.
really, they're better than words. And
Hmm,
then we just take a look at a picture. Sometimes I
yeah.
even YouTube medical conditions and I show them, okay, this is what's going on with your muscle. That's why you're having this kind of pain. So I
Oh,
try to
okay.
use different techniques.
Oh, okay. So you said so each patient has 15 minutes?
Yes.
Oh, so you have to
That's a
do
big
all of that.
problem.
Yeah. Okay, okay.
Yes,
Um,
and you can imagine, so that's not too bad in a young patient. For example, a patient your age that
yeah,
doesn't have many medical problems, 15 minutes is not bad. You can make it
yeah,
work.
yeah,
But my patients are old, so I
yeah.
have patients who are 100 years old. They don't come in with one medical problem. They come in with five medical problems, 20 medications. So 15 minutes is really not enough, but we try to make it work somehow.
Oh, okay.
Try to
So
do our
even
best.
like
Yeah.
explaining to them about their problems would be difficult if they're like 100 years old and like if
It
they
is
don't even.
difficult. That is a big challenge. Yes.
So do you deal with geriatric doctors as well?
No, a lot of internal medicine is geriatric medicine.
Okay.
I don't think we have any geriatricians in our practice actually.
Oh,
So
okay.
I do a lot of geriatric medicine by myself.
Oh, okay, okay. So it's just
Mhm.
part of your job. Okay.
Yes.
As high schoolers and college students, which are mainly my audience, um, they're always like, what do I want to do in the future, and things like that, right? And a lot of it is based on how much money they make. So how much, around generally, how much do internal medicine physicians make in a
Yeah,
year?
very good question. Very important question. People shy away from money questions, but I think it's very, very important because, money is a big part of what you want to do. You definitely want a comfortable life. Having said that, medicine, nobody should go into medicine for the money because
Yeah,
make you can end up not making a lot of money depending on which specialty you choose. You
yeah,
have to work hard a lot and you have
yeah,
to work long hours. It takes a long time to become a physician, right? You have after high school, you do 4 years of undergrad, then 4 years of medical school, and then depending on which specialty you choose, either 3 years of residency or up to 7 years of residency.
yeah,
So by the time you come out and you can work as a physician, maybe you're 30 something years old, right?
yeah,
So if you only did undergrad, you did something else, you would have been making money throughout
yeah,
your 20s, right?
yeah,
Mid 20s to early 30s. So you lose that time. So people should not go into medicine for just the money. Having said that, though, different specialties make different, their paycheck looks very
yeah,
different.
yeah,
So for internal medicine, it depends on where you're working in the country. If it's urban medicine, meaning you're in a big city, or is it rural medicine? And also it differs by state.
yeah.
Um, and then also it depends if you're doing outpatient medicine or inpatient medicine.
Oh, okay,
So
okay.
outpatient physicians generally make a little bit less money than inpatient medicine,
Oh,
not by a lot, maybe $50,000 a year or $20,000 a year. But you trade that off because you have a better lifestyle, right? You're
oh,
not
okay.
doing weekends, you don't have to
Yeah.
work holidays, you're off.
Mm, yep.
Um, for outpatient medicine in California, average is about $250,000 a year and higher.
Oh, okay.
So for most physicians who work for big corporations, after a few years of salary, you go on to a system called work RVU, meaning that you get paid based on how many patients you're seeing and how complex they are. So if you have more complex patients and you're seeing a lot of them, you make more money.
Oh, okay.
Um, but average for California, 250 and above, easy. For East Coast, it's a little bit less. For
Oh, okay, okay.
Midwest, a little bit more.
Yeah. Oh, a little
Yeah,
bit more for the Midwest?
a little bit more for the Midwest. Yes, I
Oh,
would
okay.
say 270 and up.
Oh, okay, okay.
Yes,
Okay.
yes. So for myself, I've been practicing for more than 9 years now. I bring home I don't know, after tax is not a lot, but before tax, 300 at least. But
Okay.
some years it's less because of, I took vacation.
Yeah.
So if I take vacation, I'm not seeing patients in
Mm.
that time. So then your pay goes down. So if you see more patients, you're spending more time working, you'll make more money.
Oh, okay. So, about vacation, can you take as many weeks off as you want?
No. If you have your own practice, then yes. But if
Okay.
you work for a corporate medical group, which most doctors now work for corporate medical groups, big medical groups, they tell you how much vacation you can
Oh,
take.
okay.
So for my job, I can take 4 weeks, 4 weeks of vacation per year.
Oh, okay. We know that the medical field is evolving. How do you keep up with that? How do you dial it into your diagnosis, into your prescription of medicines?
That's the easy part. So you just read. You read a lot. So I have several journals that come to my house. All of these journals are online now, but I'm old school. I like to
Yeah.
have paper in my hand, and
Yeah.
I like to read from books and magazines. So I try to read the journals as they come in. So I keep up to date with that. It's pretty easy. It's not that hard.
Are those journal open to public?
That's a I don't think so. I think we have to pay for them. So we have to
Oh,
pay
okay.
a yearly subscription.
Oh,
I
okay.
don't know if the general public can pay for them.
Mhm.
I'm not sure actually. You might be able to. My favorite one, if you are interested in adult
Uh-huh.
or general medicine, which is, bread and butter medicine, is the American Academy of Family Physician, AAFP. They also
Oh
have a
wow.
really good website. And I think they have a website for patients where they can go and read about different conditions in
Okay. Okay.
simple English. So
Yeah.
you can check that out.
Mhm.
They also have a really good podcast.
Oh wow. Okay. Yeah, I'll check them out. Yeah, I also have a website that I'm doing for neural diseases because I'm into neuro, so that might be
Oh, that's
useful.
awesome.
Yeah.
Wow, that's really good.
Yeah. So high schoolers, well, my audience is like mainly high schoolers and then also college students and students going into medicine or medical students as well. So what advice do you have for them, especially those who are going into internal medicine?
So I would, for high schoolers, I would advise don't focus on what you want to, which field of medicine you want to do, because that will change. For me, it was urology, and then I wanted to do emergency medicine, and then I wanted to do anesthesiology, and then my very first rotation in medical school was internal medicine. Actually was cardiology. So I fell in love with cardiology.
Oh,
So
okay.
I've seen that the first rotation you do, that's usually what you want to, what you end up doing. So
Oh,
be
okay.
very careful of which rotation you choose in medical school.
Uh-huh.
But that comes down the line. So for high school students, your focus, if you know you want to do medicine, it
Mhm.
should be how do I get into med school?
Oh,
So
okay.
really focus on getting good grades, doing volunteer work, doing some
Yep.
research, be a well-rounded student so you can get into medical school. And then
Okay.
specialty you can choose later. You don't have to worry about that. That will come with time. You'll figure it out.
Okay. Okay.
Yeah.
Um, and do you have anything for medical students?
For medical students, I give this advice to my family members who are going to medical school too, is be very careful of which rotation you do, the very first rotation,
Uh-huh.
because it happened to all of my friends in medical school. The first rotation they did, that's what they ended up doing.
Oh,
So
okay.
if you have an idea of what you want to do, try to get that as your first rotation.
Oh, okay, okay. Okay.
Yes, yes. But when you go on a rotation, you're in there, and you can really see, okay, do I see myself doing this for the rest of my life? So most medical students do not have a hard time figuring out what they want to do.
Oh, okay. Can
Choosing
you
a
please
specialty is
yeah,
really
go
easy.
ahead.
I was just
Uh,
gonna say choosing a specialty is pretty easy once you're in
Oh,
med
okay.
school,
Uh-huh.
especially the second half of the med school.
Yeah. Oh, okay,
Yeah.
okay. So
Mm-hmm.
can you please briefly describe what do you do in rotations?
Yeah, so in medical school, at least during my time, this was a long time ago. During rotations, you shadow the attending. Some attendings let you do a lot of things. So you go see the patients first. You do the history part, right? So you ask patients, okay, why are you here? What's going on? All those questions. You
Uh-huh.
do a physical exam, and then you kind of try to diagnose them. You come up with a
Yeah.
differential diagnosis, meaning do
Oh,
you
okay.
think if they came in with a headache, do they have a migraine? Do they have a brain tumor? Do they have an infection? And then you present it to your attending, and then your
Oh,
attending
okay.
tells you, okay, yes, this is right, this is wrong, this is what you
Okay.
need to read up on. So it's very hands-on. You
Oh,
take
okay.
all of that knowledge from books that you studied for 2 years in med school, and you go in and you're trying to apply it.
Oh, okay, okay.
Yeah, rotations are a lot of fun.
Oh, okay. Okay. Well, I look forward to it.
Yes,
Well, thank you for being here. It
thank
was great
you.
having you on my channel.
Thank you so
Um,
much.
yep. And I hope you guys learned a lot from this podcast. If you guys want more specific fields, please comment down below and like and subscribe. Thank you.